Okay, can you unshare your slide first, please? Hi, good evening, everyone. Welcome back to our usual session of webinar on a Wednesday night. I think we didn't have any webinar throughout the last 2 weeks because of Raya, and also I went for a holiday. So today I invite my friend, Dr. Teeba, who is actually currently in Texas, right?
Yes.
Okay, so Teeba is in Texas. She's in Texas for a month or so. Um, and she's going to talk to us about skin in women after 40. Basically, what we can do to keep ourselves young, maybe. Would you say young? Okay, so without further ado, we'll invite Dr. Teeba maybe to introduce herself a little and her interests, and then go on with the talk. Teeba?
Okay. Let me share my screen. Huh?
Yeah, sure.
Okay. Can you see my screen?
Yes.
All right. Okay. A very good evening to everyone. So it's actually morning here in Texas. My name is Teeba. I'm actually still with Government Hospital. I work in I'm a consultant dermatologist from Selayang Hospital. Just a little bit about my journey. I took a year off to go off to do my clinical fellowship in dermatosurgery and cosmetic dermatology. And so yeah, that's why I've got a great interest in sharing about skin health and skin aging and how we can slow the progress, and besides that, and also a lot in skin cancer and in treating skin cancers. So without further ado, I'd like to start my presentation. Today we're going to talk about skin aging after 40 years old. So a little bit of the outline of my presentation. I'm going to go through an introduction in my, and then followed by what happens in 40 and why 40 onwards is probably the key age for us to start looking into our skin health, although this should have been done much earlier, and skin changes that happens in 40s, and also taking you through the route of like before and after 40 and later on what happens, and the steps that we can take in terms of lifestyle, and also skincare and procedures that we can do to keep ourselves. We can't eventually stop aging. That is a very natural progress, so a process that happens, but we can slow down, and perhaps we can age. We like what they say, age gracefully, but we can age more gracefully.
I
So yeah.
love that.
Okay, so for introduction, as we all know, skin aging is a multifactorial process. It begins very early in our adulthood. It starts at the age of 20 plus itself, and it becomes more visible and clinically significant after the age of 40. As we know, between our 20s to 30, women or to 40, women goes through a lot of process during this very crucial period over this 10 years time, 10 to 20 years time, because that's the time we get married. Marriage is always stressful, and then you become pregnant, and you become pregnant again, and you're still working. And these days, almost all women are like, I mean, they are housewives, but house is nothing. It's not easy being a homemaker, let me tell you that. I think that's a lot of stress there itself. Managing a home alone without help, or even with help, is not easy. And on top of it, some are working and having to manage work, and and children and family, and career progression. It's a very stressful period for anyone. So yeah, and this becomes one of the major factor. And then our pregnancy and the hormone changes that happens is another factor, and the natural aging process. So our skin structurally, cellularly, and functionally age, and this leads to all the aging signs that we see: wrinkling, volume loss, pigmentation, and laxity, skin laxity. So there are two factors to it. Like there's intrinsic factor that nothing much we can do. We inherited this genetically. Some of us have got a very good genes. We have very good skin. Even you don't easily look old, and you don't gray that fast in your life. So yeah, that's natural interest. That's an interesting factor. But this process is inevitable. We will end up having thin, dry skin, wrinkles, and gradual dermal atrophy. Then there's an extrinsic factor. This is something else that it's within our control. We can try to do something about it so that we can delay the aging process, especially, leading a stress-free life, having good enough sleep, avoiding smoking and air pollution, and also sun exposure. Okay, so these are the extrinsic factors that can eventually lead to your fasten the skin aging, and you'll see more of this as I present. I explained this earlier. So what happens in intrinsic is a slow and progressive process. This affects the telomere, it causes the telomere shortening, and then the hormones decline of estrogens, and this reduces the fibroblast activity, and there's a dermal thinning. And extrinsic primarily is actually a UV radiation, pollution, smoking, stress, poor sleep, and diet. And this leads to reactive oxygen species release that triggers the inflammation and matrix degradation. This reactive oxygen species plays a key role in the aging process. This slide I just put up as like I heard this public is, might be listening to this talk. And also just to recap, when we talk about, when I mention epidermis and dermis, so what do I actually mean? Epidermis is the topmost layer. You have your keratinocyte, melanocyte, and Langerhans cells, all these cells at this layer. This provides the barrier, and also it is a key factor for your pigmentation process that happens here. And then you have the dermis layer. Here you have the fibroblasts, collagen type 1 and type 3. Type 1 collagen is more than type 3, about 80% consists of type 1. And this type 1 collagen is what starts reducing as we age, and then, gives rise to all the skin laxity and wrinkling and all. And then you have elastin, vascular, and ECM stands for extracellular matrix. This layer is very important for strength and elasticity and support. And then you have your subcutaneous layer here, which composes of your fat lobules and blood vessels and other connective tissue that provides the contour and cushioning of the face. So contouring means like, like your face, you have like a rounded shape, and you have a body shape. So that's contouring shape of the face. And then your skin appendage, you have hair follicles and sweat glands and also oil glands. Okay. Next, I'm going to talk about the factors that contribute to facial for aging. Generally, we are talking about facial aging. And a very interesting study was done in Twinsburg, Ohio. So this particular village has got a lot of twins, like identical twins. So every year there's a twin festival happens. So generally what happens is during this period, sometimes this research, any research institute takes this particular time of the festive to run studies. So when you have identical
Oh,
twins,
so interesting.
yeah, it's one of my favorite study. It's done in, it's 2008. This study was done between 2006 to 2007. It's really one of my favorite study. So what they do is they interview, it's a questionnaire based, and then they assess, like in this particular study. So in 2006 and 2007, they had a total of 96 identical twins, sets of identical twins, and where they gave them questionnaire, they looked into their lifestyle and it's like looking into all these factors, the exposure to all these factors, and then their lifestyles, and then they sort of like compared if the a twin had a body mass index, only body mass index that's differed, like one is higher, one is lower, how did they look in terms of how would you stage them in terms of their aging, so you assess them. And then there's another factor, everything else is fixed except the duration of exposure that particular set of twin had. Then you assess how it affected their aging. So like that, these are the factors that they looked into: body mass index, duration of sun exposure. No need to, as we all know, more sun exposure, it is more aging. Skin history of skin cancer, so more history of skin cancer, more sign of sun exposure, more aging. Cigarette exposure, need not say. cigarette smoking, increase aging. Duration of hormone replacement, the ones who had hormone replacement, they actually looked younger compared to the longer they had a hormone replacement therapy, the younger they looked
Oh,
relative to their twin, compared to their twin who did not have a hormone replacement therapy. And then history of radiation increases the aging, and chemotherapy associated aging. Marital was quite interesting. Um, divorced ladies were seen to have more seem to have age look like they are older compared to single and married. So yeah, and then
but it's
activities.
interesting because if I were to do the observation now, but the study was previous long time ago, right?
2008, yes.
Yes, right. So if I look at it now, I feel like divorced women maybe it's because they put in more
Maybe might be different. They might be happier. Yes.
effort. Okay, definitely
I mean,
happier.
this is sorry. I'm just telling the study
Yes,
findings here.
yes,
So
right.
I agree with you. I think times have changed. A lot of things are different now. So
Yeah.
yeah, that's something else that was in the study. Not my
Yeah,
opinion.
no, no, I understand. I understand. No, it's
Okay.
not. It's just that it was so long ago. The perception of divorce was also different. And
Exactly.
now, also divorcee don't see as a stigma or a taboo anymore.
So
So
I would just take it as
yeah, that's right.
they were
It's
younger,
interesting. Yeah, that's right.
less stress,
Okay.
less stress, happy marriage, less stress.
Yes, we go.
Otherwise unhappy situation, walk away, less stress, happier.
Yeah.
Yeah. Okay, so something about body mass index is also interesting, that they found that those who had higher body mass index before the age of 40, like it made them look younger. Okay, those who are under 40 with high body mass index, they looked younger. But those over 55, when they had a higher body mass index, this made them look, uh, okay, am I getting this confused? So they looked,
Wait, let's
wait,
see.
let me just get this right. So
Okay. Body mass index. Let's
body mass
yeah.
index. So it was associated
Hmm?
with an older appearance in age group younger than 40. Sorry, it made them, when they were younger,
Hmm.
they had a higher body mass index. It it made them look older.
Okay.
Okay, before 40, if high body mass index, that made them older. But if after 55, if
Mhm.
they had a higher body mass index, that made them look younger.
Okay, can you just please define to us what does body mass index, what what does it entail? What is it?
They compared it in the way that in the study it's mentioned.
Uh,
They divided into 4 point difference.
okay,
Like if you're talking about between 25 and 29.
okay,
So when they had that more than 4 point difference. They didn't like specify like 18 to 25, 25 to 30, not like that.
okay. But
So
body mass index, is it a weight or
body mass index is like is weight and height taken into consideration. You count
okay?
it,
Yes, that's right.
right? Yeah.
BM, yes, right.
So the BMI. So
Yes,
it's the BMI,
yes.
and then with the BMI, so they took into the consideration of the points, like 25 to 20, like 4 points
Yes.
differences.
So
Yeah.
because a lot of people do believe that as you age, you shouldn't be too skinny.
Yes. I can actually explain this because you see,
Okay.
what happens is in the aging process is we lose fat pad.
Mm-hmm.
Okay. So when we lose fat pads, I mean later in my slides I'll explain the layers of fats in our skin. We
Okay.
have superficial, we have deep fat, and those fats actually gives you that nice rounded cheek appearance. You do not have the sunken. You have a fat pad here and around your cheek area and your chin area. So as you age, when you will eventually, there's a fat atrophy.
Mm-hmm.
yes, along with aging, and if you're also very thin, and you generally have lesser. So we all see that, right? When you put on weight, your face becomes chubby. When you lose weight, your
Yes,
face
of
becomes
course.
sunken. So yeah, and and even when you put in fillers and everything, you're trying to target these fat pads. So you
Yes, yes,
artificially sort of like, what you have lost, you're trying to replace it.
yes.
So
I
I
get
guess that's why as you age, and when you age and you lose weight and you actually look much older.
like
But
haggard. I think the word people like to use maybe haggard
yeah,
because
okay.
we can't decide. We cannot try to lose weight at certain places only. When we lose weight, we lose all, and then we lose on the face too.
Yeah,
Yeah,
so
I get.
hence that's why most, I think most people when they actually lose weight and to maintain the face and the youthful look, filler and yeah, biostimulators are the ways to go if you're keen on that. Yeah. So the next is cigarette smoking. You can obviously guess from the picture. Uh, Twin B does not smoke. Twin A smokes, and she looks much older,
Hmm.
and that's what they found. And then in sun exposure, twin A had limited sun exposure and twin B had higher sun exposure, like 10 hours per week, and she looked a lot more aged. So this is something very, very common, and I see this a lot here in Texas because they are all whites, right? Yeah.
Yes.
So you see them, the sun, those who are practicing active sun protection, they look a lot younger. Okay, and then hormone replacement therapy, sorry about the spelling. And so estrogen and progesterone therapy has made people look younger, and this finding was very significant. So the anti-aging effect was stronger in the older age group. The longer they used, and it actually had better effects on them.
Wow, a lot of difference, huh?
Yeah. So now, next I'm moving on to like looking into the explaining a little bit of the molecular pathways in skin aging. As you can see here, the UV, the extrinsic factor, the sun exposure, UVA, UVB, and your infrared, and then other environmental factor like smoking and air pollutions, it activates your reactive oxygen species, and then this eventually leads to oxidation of your DNA, protein, and lipid, and induction of angiogenesis. And in this pathway, it leads to influx of neutrophil, and all this eventually lead to your in the degradation of a collagen and fiber. And another way is that ROS activates the activation of MAKP pathway, and this eventually causes the when this pathway is activated, and it increases the metallo MMP, we call it is metallo um, uh,
Don't worry.
MP is
Can't remember also.
matrix metalloproteinase. Sorry for that. So yeah, and then it activates that, and this MMP increases collagen degradation. This causes the collagen and elastic degradation, and eventually leads to the aging process. And yeah, so all this leads to, and when you have an activation of aryl hydrocarbon receptor, and this causes the activation of the melanocytes and leads to all these age-related pigmentations that we see. All right. So yeah, this is like a molecular pathway, and sometimes a lot of creams that comes in also targets alongside of these molecular pathways. So what is the skin aging process in 40s? As I spoken earlier, these are all the changes that happen slowly and leads to all the skin aging that we see. Epidermal thinning, dermal changes. This is a main key factor, a role player in aging is a cellular senescence. This activates this S8SP pathway that leads to release, which includes the release of all these interleukins and also MMP that causes the inflammatory process. And then is your fat distributions get affected. There's a dysatrophy and also inferior displacement due to the gravity. I'll explain this with pictures later. And then hormonal changes and environmental exposures. So just a little bit about aging. We all know that's aging, and what we see externally is just the skin. But besides that, there is also bone aging, there's a fat aging, and then there is connective tissue like all your ligaments aging, and also the facial muscle which goes through atrophy and all that. So bone remodeling, what happens with age is that we have a bone resorption which is accelerated, and morphologically it changes the our bone structure. There's a bone resorption that happens at the margins of the bone, at the mandibular area, at the maxillary bone here, and also the orbital rim. So as we age, we have a larger orbital, so you get a more deep sunken eye. You have like your maxillary is more flattened and narrower compared to when you were younger, and then you have a shorter mandible. So all this, besides your soft tissue aging, there's also a bone resorption. And then you have facial pads and ligament. So face contains like a deep fat and also superficial fat. What you see in the pictures are the deep fats. Superficial fat is just below our dermis, a thin layer that covers all over. And then you have and is separated by fascias, and also it's like there's a ligament. As you see all these lines here, it's supported by the ligament. There's orbicularis retaining ligament, and then you have your zygocutaneous ligament, and you have your mandible ligament, which holds all this up to our face tightly, because the true ligaments, they attach to our bone and they hold the tissue up tightly. And when we see as we age, we will always there's like a fat atrophy, so the volume of the fat reduces, and then there's a gravitational pull, and because our skin is not strong enough, there's a dermal thinning as well. It just starts sagging with this thing. So that's why you always see this, like they call it jowling. There's a medial fat, like like drooping down, and
Yeah.
you see the sagging thing, and then you see the jowling at your neck, and then you see a more prominent more prominent fold. Here, this is the jowling that I was talking about. You see a prominent nasolabial fold, prominent, marinette line. This line is called the marinette line, and all the wrinkling becomes more prominent. Okay. So yeah, that's the kind of aging that happens, and this changes starts very early, like the skin aging from your 20s as photo damage, and then reduce in antioxidant level, and it's slowest in your 30s. You have a slower cell overturn rate, and there's early collagen loss and pigment irregularity, and 40 you have visible wrinkles, and then fat pads becomes there's a drooping, and then loss of elasticity. In 50, everything looks more prominent, and you start having your facial bone remodeling as well. So this is like an overview, structure by structure. In your epidermis, what happens is thinner, drier pigment issues. Dermis, there's a collagen loss, elastin, and in your hypodermis, which is in your fat layers, there's a fat atrophy, and then volume loss. And in bone, there's a recession and altered facial angles that you will see.
Teeba,
So,
sorry to interrupt you, but can you speak slightly louder, please?
oh, okay. I'm sorry.
Yeah, maybe you come closer, because
Okay. All right.
we have a request from the Doquity people that yeah, I also have to go very near to listen to you. Yeah,
Okay.
sorry.
I hope. Okay. I'm
Yeah.
so
I'm
sorry.
so
Thank you
sorry.
so
She's a
much for
very
reminding.
yeah.
So much
I
of
know Teeba,
information.
she's a very demure person, not like me. Okay, go on.
So
Yeah,
much information should be loud and clear.
yeah.
So anyway, I'm happy to take any questions later
Yeah,
on, if anything that anyone didn't understand further.
yeah.
So this is basically an overview of the changes that happens layer by
Oh,
layer.
so much
It's
better now.
important. It is very important that we are aware of this, because when you are choosing your treatment, you should know which layer you're targeting and why you're doing that treatment, because that's how even your aesthetic physician or your dermatologist, that's how they also supposed to tailor the treatment for you. If your problem at as whichever age you go to, if your problem is mainly at the epidermis layer, then you target the epidermis layer. If it's more towards the dermal layer, like the issue is the collagen loss, depending on your age and the structure of your skin and the feel of your skin, then you go for this. So it's a targeted treatment based on your layers. So that's where it's getting at now. In fact, it's very interesting now. There's also a AI that they are developing. Maybe it's already developed in US and undergoing trials already, that I know in one company, where they screen your face and they come up with a treatment plan for you based on what the AI has picked up, which layer you have issue and what other issues, and what is the treatment plan that it advise you to go for. Interesting.
Yes.
Okay, so now when we talk about skin changes with age, we have to divide it into two. We want to know what is physiological skin changes, and then there is a pathological skin changes. So knowing your physiological skin changes, you don't get alarmed easily, and also you know that when you get these spots, they are normal. So of course, the rest of it I'm not going to repeat. I have already mentioned all this dryness, loss of elasticity and wrinkles and all that. But age spots. So here, very interestingly, the professor that I'm attached to, when he does a skin check for skin cancer, he always calls this wisdom spots. We all know it as age spots, but he calls it wisdom spots. So the older you are, the more you get, the more, it's a sign of wisdom. Interesting. So
Have
yeah,
plenty.
when we say age spots, what do we mean? To those who are doctors, you will know that this is seborrheic keratosis. Okay.
Oh, I
Uh,
see.
yes, and seborrheic keratosis is a normal part and partial of your aging. So it starts very early, like sometimes even in the age of 30s, you will start noticing that very tiny, tiny dots, like on your cheek or your face, or a lot of it around the neck. It happens around your sun exposed areas as well. So this is something, if you remove it, if you find it troublesome, it's best to remove it early, because when it's small, the minimal damage that you do to your skin when you're removing it. Okay, so yeah, another thing is all your solar lentigens, sun exposed spots, where you have this brownish macules and patches on on your sun exposed areas. And then the skin tag is a skin color, I think everyone knows what is skin tag. So that's another thing. And cherry angioma, the red dots that we see on our skin. Yeah. Okay. So
Sorry,
those are kind of,
let's ask you, these age spots or wisdom spots, they are not like the pigmentation, is it?
so yeah, there is a pigmentation, which is all your the solar antigens and everything. And then the age spots, it starts like a small tiny papule, and then it starts
Oh, I
growing like
see. It's
flat.
yeah, I
The
don't.
stuck-on lesions.
I see. Okay.
I'm sure you'd have seen it in a lot of elderly patients.
Yeah.
I'm sorry, I should have had a picture of that.
Okay, don't worry. I thought it was like those like a large freckle. Like I have lots of those black it,
Yeah,
but
yeah.
it's more than that, right?
I think you see the two types. One is seborrheic keratosis, another one is all your solar lentigens. So solar lentigens, they look like just flat. They're flat and they're brownish patches and macules,
Oh, okay.
right?
I've seen
Okay.
that. Okay.
And then seborrheic keratosis, they're raised.
Okay. Yes,
Yeah.
okay,
Okay.
go on.
Then now, next is age-related pathological skin changes. I will not do justice if I do not mention this precancerous and skin cancers, which we are seeing more and more these days. I think I'll pick up in a month about, at least in my private clinic, about two or three, which to me I find it very common. All right. It's increasing the incidence. So actinic keratosis is a precancerous. So eventually, when you don't treat it, what happens? And this happens mainly in terms of Malaysian, a lot more in the Chinese, and of course those Europeans, whites who are staying in Malaysia, and in the fair skin type, because you have less sun protection naturally, right? So actinic keratosis is a very rough. You don't see it, but you feel that rough spots. If you just go and examine any of the old patients, just run your hands through run your hand against the skin, you will actually feel the rough spots. And this is actinic keratosis, and usually when you have this, you need to get it treated. It's very easy, just cryo and then it's off. Or you can even use some creams to get it off, like your imiquimod and all that. And then basal cell carcinoma, it starts as a small papule or nodule, and then it starts growing. And basal cell is the most commonest skin cancer in Malaysia. And then the second most is your squamous cell carcinoma. It's like a erythematous, scaly patches and plaques. And then is another one more, which is the most dangerous, is the melanoma, because it has got a tendency to spread. Basal cell carcinoma and squamous cell, most of the time squamous cell can spread, but not as aggressive as your melanoma. So the rule of ABCDE, asymmetry, asymmetrical border, asymmetry, and then the irregular border, the color variation. It's not like a dense thing. You see like a color of like it's different brownish tone, and it changing, and the diameter more than 6 mm, and it's evolving, meaning to say it is increasing in size, it's painful, or it's bleeding. So these are the signs. So when we see a patient, we always have to ask this one question on a very quick: do you see anything? This is what I'll always ask, like any of your moles or any of patients. Sorry.
No, just somebody. Don't worry.
Okay. Any skin lesion that is growing in size, that's changing that's changing its shape, and also is it bleeding, or is it like has it become a wound? So just a quick this thing and have a look at it. Okay, so this is another, just to sort of think, there are other pathological skin diseases which also happens with certain age. If you look at this particular, I thought the study was very important, very interesting. It was a prevalence of most common skin disease in Europe. It involved about 27 European countries, about 45,000 participant. It was a questionnaire-based study, where they found that between the age 26 to 54, the incidence of certain skin diseases was actually more common compared to the younger or the older group. The number was definitely higher here. Um, and then so there was like a, in terms of the reported disease, fungal infection, we see that very commonly in Malaysia. And then acne, and also acne rosacea. There's adult onset of dermatitis, and alopecia, of course, there's an age-related hair loss that we all see in our age. And psoriasis, there's a adult onset after the age of 40, yeah, and so on. Okay. So why intervention after 40? I've explained this earlier. There's accelerated collagen degradation begins around the age of 40, and preventive treatment is more effective than corrective. And yeah, and at the age of between 35 and 40 and all that is when we want to start paying more attention to how we look, to improve, and we start noticing everything about ourselves. We start wearing makeup around this age. I think look is very important these days. All of us want to look like Koreans. Okay. So in my next few slides, I'm going to go into skincare, and then I'm going to move on to talk about energy-based devices, that chemical pills that we can have, and then energy-based device, and subsequently a little bit about injectables. Okay. So the first step, first and foremost, is preventing, sun protection. I think everyone knows this by now, because it's the public education is so much on sun protection and the importance on it. Always remember SPF 30 and more is good enough. And I like to highlight here one thing is that there's always makeup products that come with SPF 20 or SPF 30. So is it good enough? Like, can I just use this and not? I get this question. So the answer to that is, you don't apply the amount that you should apply when you're applying your makeup product, because although it's SPF 30, if you're going to apply just a thin layer, it's not going to offer you any protection, because if for the whole of your face you must apply 1 teaspoon of sunblock, like a
So
1 teaspoon.
much.
Exactly, so much that you see when they tell you it's SPF 30, they have actually put in that thick layer and tested it in the lab. So that's how all your SPF 30, SPF 50, and 150, whatever that comes on. So yeah, and
I always put the size of a pea. Okay,
No.
tomorrow I will put more.
So, yeah, so that's why the amount that you apply is important. You have to apply at least, lah. I mean, they say 20 minutes,
Okay.
but at least 10 minutes before you go out in the sun. And you have to reapply. You cannot just like morning one time and
Oh
you
my God,
expect
I never ever reapply. Even, oh my God, okay, I will reapply.
tell
I go out to
anyone
the sun
to.
so much. Every activity of mine involve going out to the sun. Okay, okay, I will reapply.
So, so yeah, definitely. So, that's only one thing that you're talking about, but sun protection is not only what you apply. It's also your protective clothing, especially when we are driving. Most of us are in that hot, trapped, UV light. Everything is trapped all around us. So you must, especially when you're in the car, when you're driving, you have to cover your hands. Okay, with UV protective clothing you can get in Uniqlo. There's a jacket I like that particular jacket from Uniqlo. It's a UV protective. I use it all the time. And then and your sunblock, the amount that you apply, and hat if you're going under uh, you know but this is more towards I believe that none of us do so much of sun related activities out in the sun so much, but if you do, then it's preferably wear a wide brim hat, and then yeah, seek for shades, and then your sunglasses. So coming to that, so here there's like 1 ounce of sunscreen is enough to fill one shot of glass, and it's amount that is needed for all the exposed area of body. And here I think you're talking about your hands and your feet and your face. That's how much you need. So
Oh my
yep,
God.
and apply if you're under the sun. Suppose the whole day you're doing a sun related activity, apply every 2 hours. But if you're not, if you're doing office based work, in the morning before you go you apply. In the afternoon, if you're going out for your lunch, just you don't have to wash your face, just put the sunblock, and then you can top it up with your with your powder, and then again in the evening before you drive back. Okay, so those who are having a very sensitive skin, you can actually choose the physical sunblock, which contains the titanium oxide or zinc oxide. Otherwise, there's a chemical sunblock that's available. I mean, it's a chemical. There are two types, physical and chemical. The contents are different. And then for children, of course, the physical sunblocks are better. And yeah, that's the thing about sunblock. And there's no such thing as waterproof. So if there's anything that says waterproof, I suggest you don't buy it. That's not true. There's only water resistant. Okay.
Okay.
And then next, this is about retinoid. The first paper I found was about retinoids in 1988, and from then till today, this is the gold standard for photo aging. So I can't stress less on this. Retinoids, I'll explain further about the terms of what we hear. We hear retinol, we hear tretinoin, and we hear this thing. What does all these mean to us? So just to go down a little bit on this retinoid, it's increases collagen type 1 and type 3, and also your 7 synthesis, reduces the MMP activity. Remember, this is the enzyme that causes the degradation of the collagen and your elastins, and it normalizes the stratum corneum compaction. So it helps in your anti-aging. The only problem with this is the irritation that one can get when you first start using it. Even when I started using it at first, like so carefully using it, I still had my share of skin irritation that happened. So the way to start is when you buy a retinol based product, you start using it first 2 times a week at night. Remember, use it at night. Of course, these days they're coming up the studies that making it more stable, less photosensitive. Why you apply at night? Number one, because it increases the photosensitivity and it's not photostable. So that's why you use it at night. And number two, when you start 2 times a week, and what you do is you apply a layer of moisturizer. It depends on the kind of things or the type that you're using. If you're using a cream based tretinoid medical product, you mix it with moisturizer. You mix it like 1 portion to 4 portion of moisturizer, depend, and then you apply on your face 2 times a week When you're okay, you increase it to 3 times a week, then you increase it to every other day. Then once you're comfortable, you can do it every night. It's the best thing if you get into your skincare. This is one of the best anti-aging that you can have.
Okay.
So what is retinoid? It is an umbrella term for a chemical compound that natural or synthetic derivative of vitamin A. And what is retinoid acid is the biologically active retinoid that going to work at the cellular base in our human tissues. So what is retinol subsequently? Retinol is what it is the main circulating form of the vitamin A that eventually it requires to be in our body to be converted to active retinoic acid for it to have the effect. These are over the counter products in most of the skincare. That's why most of the skincare you will see retinol, the name retinol in it. Tretinoin, it is another synthetic version of the biologically active retinoic acid, and it's mostly used for skin aging, and this is a prescription medication, tretinoin. So now these are the generation of retinoids. You can forget about this isotretinoin. These are all oral. Now look at this tretinoin. This is a prescription medication, and then you have all this, which is a non-prescription vitamin A derivatives that can be found in your skincare routine. Okay. Now next is what it does. I explained earlier. It interacts with the receptors in your keratinocyte at the epidermis layer. It promotes proliferation. It strengthens the epidermal protective function. It reduces the transepidermal water loss. It protects the collagen against the degradation and inhibits your MMP. And then it has effect on photo damage and induces the production of hyaluronic acid. All that's needed for your anti-aging. So it's a very good, skin care to, include it in your skincare regime. So besides that, there are many others these days. I will never be able to give a summary of everything, but these are the main things. Antioxidants, which is good for your ROS to make it more stabilized. And then hyaluronic acid, they've come up with more and more molecular base where it can be absorbed into the skin, and it can help reduce the fine lines. And then there's peptide, then the exfoliative products like AHAs and BHAs. You may want to use this about once or twice a week so that you remove the dead skins, so that you look more glow, you have the glow. In fact, your chemical peel is all about removing the top layer of skin, right? And then if you have a pigmentation issue, then it's a thyroxine inhibitors that sort of like reduces the pigmentation. So then there's another range of it, like hydroquinone, arbutin, and kojic acid, licorice. The list goes on. So at the end of the day, the other things that we use, we always have to go by what we need. So the basic is cleansing. The basic skincare that we need to have is essential skin daily routine is cleansing. So number one, make sure if you're wearing makeup, make sure to use a makeup remover. That's very important. And then you double cleanse and apply what's the first things that you need, like that's really like, is it a prescription? If your doctor has given you some, patients always ask me which layer, how do I layer my products? Okay, so it's always washing your face, followed by the most important thing that you have to use, whether it's a doctor's prescription or is of your skin concern. You have a pigmentary problem, so you want to use something to reduce the pigmentation, or wrinkling issue, you want to use that serum for your wrinkles. So you apply that first, and then moisturizer, and then becomes your sunblock. At night you don't have to, but daytime sunblock, and then is your makeup last. Okay, and then is your exfoliation. Okay, and subsequently the next so that's about it. So this is the whole process. Always target your treatment, so according to what you need. Choose the product that suits your skin, know your skin type, and choose the product based on your skin type. Okay, chemical peels next. There are 3 different types of chemical peel based on the depth and what layer it achieves. I'll go through one by one. Superficial peel is it's up to your epidermis only. It penetrates up to that. It's a very most of the time you won't even see. There's no downtime to it. You won't even see it exfoliating much, or very mild exfoliation. These are all the AHA pills like your glycolic pills that you see, and your lactic acid or mandelic acid pills. And what is it used for? For mild photoaging, mild fine lines, mild uneven pigmentation or acne or melasma, very gentle. So generally, my advice is, if you're first time trying a pill, always go for the gentle pill. After that, maybe if you can tolerate, or if you're not a dark skin type, then you can go to the medium pill. So medium pill, there's a different concentration of different component, and different concentration is used. Even in your glycolic pill can be a medium pill when it's 50 to 70%, and then your TCA, the trichlorotic acetic acid, and it's basically the downtime is between 7 to 14 days, and you will see visible peeling effect. And usually it's best to be done, it's an office-based procedure, best to be done under a doctor's supervision. And the indications are listed here, like your solar lentigines, actinic keratosis, like you do have some very visible pathological problem that you need to address. Deep peel, it's almost we never do here, but it's very it can be done in Caucasians because of their fair skin and they don't get pigmentation. The problem with our Asian skin is that we can not only that you may get a post-inflammatory hyperpigmentation, you can get post-inflammatory hypopigmentation, or it end up having a very uneven skin tone, and honestly this is a disaster. So generally we don't use this, but if you use it, it works. Like, it really changes the way your skin looks, because it peels off the whole layer up to the reticular dermis. Next is the energy-based device. And so what does energy-based device? Laser, basically laser. How can it help? So it can help by, because of the wavelength is being delivered to your skin at different level, at epidermis or dermis, and the kind of, and it targets certain parts of your skin. It can actually help in collagen remodeling. This works, I've seen it working in, you will see, but not in one session. It always needs a repeated session, and why you are doing it. Okay. And then there's elastin regeneration and dermal restructuring. And also these days we have lasers that target energy-based device, not lasers like a ultrasound-based device that targets fat reduction. But you need multiple sessions. It's not like one session you will see the big improvement. So going down to the energy-based device that can be used for anti-aging, in terms of your lasers, you can divide it into ablative and non-ablative. What do we mean by ablative? Ablative, you're targeting the superficial epidermal layer. You're literally like ablating, removing the top kind of thing. And then this is one way. Or non-ablative, where the effect is more towards the lower at your dermal without damaging your epidermis. So minimal downtime, can be used in a darker skin. And nowadays we have fractional laser, which is more it can use in wide range of people, skin colored people, so you don't have any post-inflammatory hyperpigmentations issues. So this all targets and your dermal or collagen level. So the indications differs depending on when you want to use it. You want to structurally remove all these age spots, so you go for the ablative. But you want to have it for skin rejuvenation, then you go for the non-ablative. And also ablative, if you're really like going for the structure, you want to change the structure, then you can use ablative as well. And next is your radio frequency.
The structure of your face, you mean?
Sorry?
The ablative can change the structure of the face?
What do you mean by structure? Sorry.
Oh, no, the last sentence that you say that.
Sorry, it's a texture. It's
a
texture.
Texture. Okay,
sorry.
I heard structure. Yeah. Texture.
Okay.
Yeah, I understand.
All right. And then radio frequency, basically, I think many would have had like RF, microneedling and all that, what it means and how it's used at different types. There's so monopolar are like your Thermach and all that, or Alexis are the brands. I usually don't mention brands, but just to give an idea what I'm talking about. So what happens is the electric is actually an energy flow. It runs down. So if it's monopolar, it comes out through a grounding pad. The electric goes through and comes out to a different side, and this usually can penetrate deeper and target deep dermis and subcutaneous. What it does is basically it gives you radio frequency. It gives you it causes a skin tightening or lifting or contouring. Okay, it can even give like a full face tightening or non-surgical body firming and all, but not in one session. You probably have to do multiple sessions to see the effect. And then you have this bipolar where it's more superficial. It targets the superficial layer, so it improves the fine lines and skin laxities and also reduces the reduction, and it can be used for under eye tightenings. And then you have multipolar, more newer ones that targets the dermis and superficial fat, and this can improve the cellulite reduction and even the skin firming on a larger areas like your abdomen, thigh, and also arm tightening. And you have this micro needling RF. This is actually one of my favorite. Uh, it delivers energy through the needle, like tiny needles penetrate your skin and then it delivers the energy. It's more precise and you can target between which level you want to target, because you can adjust it, whether you want a 0.5, you want a more epidermal, or you want to target the deeper dermis. So yeah, it can target and it can be used for acne scar, and the outcome is quite good, and also for wrinkle and skin texture. And then with this it induces collagen and there's a rejuvenation. Okay, next is I will not do justice if I don't mention about pigment lasers and also vascular lasers, depending on the indications that we are using for vascular lasers. Like we can use for anything that's like, you have the skin blood vessel, tiny blood vessels around your, on your face, your rosacea, so you can use that. And for pigment, it's all your melasma and your brown spots and everything. And then you have ultrasound technology as well, and this is the famous Altera and HIFU. So what this actually is, where it works is, it literally works depending on the depth that you're going in. So the ultrasound that's produced, it induces thermal injury, like a heat. It produces a heat just nice, between 65 to 70 degrees Celsius, without damaging the superficial layer of our skin. It produces the heat at that level, at the collagen level, and it causes stimulation of collagen, new formation of the collagen. So if this is the skin, and depending 1.5 to 4.5, depends on the cartridge that we use, we can target. And what really works is another thing is, it can target, when you use this, you target the SMAS layer. This is superficial muscular neurotic layer, eponeurotic layer. This actually the lot of like reticular ligaments here, and you target this layer to sort of improve the collagen stimulation and tighten up the skin. So it gives you the skin tightening, and usually it's done once a year, and it works quite well. And this is like your HIFU and your Altera. Very nice. I like this as well. So next is injectable, the last bit of it. A lot of times when we hear injectables, we always get scared with all this overfill syndrome that we see, but it depends on how you do it, when you do it, and for what indication you're doing it. And you must always target for your restore what has been lost. That's my idea. Like, or if there is a defect, you try to correct it. That's how it should work. It's not something like, you keep doing it, and you should know your limitation. Don't overdo it. So botulinum toxin is, I don't have to explain Botox. It's basically, to prevent our static lines, our dynamic lines. So what do you mean by dynamic wrinkles or lines? When you raise your eyebrow like this, you see the wrinkle, or when you when you are angry, you see the wrinkles here, the gabella, the angry line, and your crow feet around your eyes. So you inject muscles around this area and relax it. You're paralyzing it, so that when you sort of move, and you don't see the wrinkle. Why should one do it? Okay, is it really important that everybody must do it? It's not like that. It's like, if it bothers you, you do. But the good thing about taking Botox injection is that you slow the progression of getting static wrinkles eventually. Okay, and how often you do it is this thing. Don't do it too often. Do it about, break it between 4 to 6 months once. I like to do it every 6 months for my patients. Yeah. And then you have fillers. Fillers is a volume restoration. That is the most important thing one need to understand. When there's a fat atrophy, you feel like you have a sunken cheek, sunken temple, or you have something that you need to correct. Here is sunken, you're too thin, this part makes you look aged. So you correct what is lost, or you correct what is not there. So to give you that round, nice face that everyone wants, gives you a healthy, nice look. And then you have biostimulators these days. It stimulates. These are injectables that injected into your dermal layer, or or even superficial dermal layer, or superficial subcutaneous, where it stimulates the collagen production and rejuvenate the skin. And you have skin boosters. So these are also like intradermal injections that they are most of the time is hyaluronic acid, non-cross-linked hyaluronic acid, which improves the skin health and hydrate the skin and improve the skin quality. They also make you, there are some that can make you brighter. It makes the face brighter, more glowy, more youthful looking. It improves the fine wrinkles. So there are many products out there. You choose the right product based on what you need, what is the indication. So this is just to give an idea about the overfill syndrome. Okay, we all know the sunken eye, the flower horn foreheads that protruding outside, chipmunk cheeks, your broad nose, and your dark lips. Yeah, we want to avoid that. So you don't want to overdo it. You just want to achieve that normal, the
Hero.
achieve your natural look. Yeah, you want to just look naturally, pretty. So this is Botox. I explained this earlier. And yeah, this is the overall the summary of my whole presentation. So at the end of the day, we should have a targeted treatment. So if you're going for your epidermis, it's more towards all your skincare, your chemical peels, and some of the lasers, depending on what you want to correct. And then dermal layer, you can you want to restore your collagen and reduce the elastin breakdown. So there's injectables to it, microneedling, radio frequency, lasers. And then you have this fat, you want to correct the fat atrophy and sagging, then you go for all the fillers and biostimulators. And for muscles, it is your botulinum toxin. Okay, and
Okay,
that's
we will take
my,
questions. Okay.
yes.
And of course, this is the Central Dermatology Specialist Clinic. Where is it?
This is in Nexus Bangsasar.
Oh, okay, okay.
Yeah,
Okay, I need to share
okay,
the eCert registration form, but I don't know where I sent it to. Okay, there are many questions coming in, and
okay.
Christine asked, cherry angiomas related to liver problems and are skin tags related to insulin resistant. Are they in? Are they?
Okay, so not cherry angiomas. Okay, cherry angiomas are different. If you're talking about spider nevi, then yes, that's associated with your liver diseases. Okay, that is different from your cherry angioma. Cherry angioma more like it'll just look like a tiny papule, like a tiny blood spot, like it's a raised papule. Whereas your cherry angioma is more like it's a macule. Yeah,
Okay.
and then skin tag, yes, it is related to insulin resistant as well. Yeah, your acanthosis nigra, and that aggravated, and you have the skin tag formation. But acanthosis nigra is what you see. This is like acanthosis nigra is different from your skin tags. Okay.
Okay, I've just shared the the Google form for the doctors, and then this is for the ESET. Okay, we go on with the questions. Um, I think there's Dr. Wan No asked, how about the efficacy of spray form of sunblock? Does it carry the same efficacy as cream or lotion?
I would still think depending on how the product is made and all that, HalioCare has proven to have the similar efficacy. I mean, as much as I know in terms of their studies. So they have got a very good product. So it has to be something that you spray and it covers this thing. So the amount is what is important. It is not the form. It can be cream or lotion or whatever, but the amount that we apply is important. So it gives you the similar efficacy actually if it's applied the right way.
Okay. I have a question myself. You know, there are a lot of product that says it's oral collagen. Does it work?
One has to understand the kind of collagen that we need, and whatever collagen that we take in, it's always being metabolized in our body. It
Mhm.
can never be that, and the amount is raised. So there's a lot of studies going on, but honestly speaking, there's no strong evidence to it until this point. That's my take on it.
Okay.
I'd
And
like to answer this one question
that's
about
right.
pico laser. So pico laser very popular. Could you comment on its use for melasma, please? So in terms of melasma treatment, one has to understand that it is a comprehensive treatment. So a lot of times, we are just directly thinking melasma means, laser will work. No, that's totally wrong. So it always starts with your very basic skin, sun protection, and your there is like your pigmentation cream that you can use, all your tranexamic acid, arbutin, and even a short duration of hydroquinone, these triple creams, and then oral tranexamic acid. And your laser always comes as an adjuvant therapy. It's not the first line. One has to remember that. And whether pico laser is the best or not, to me, in my opinion, nanosecond or pico laser, they are all about the same. It depends on their user, who the operator of the device.
Oh, I
But
see.
for the and of course this, because of the short duration and how it's delivered, in that picosecond, it has got less collateral damage. It tends to be work better for patients with a darker skin type, less side effects from there. But treatment of melasma per se, not only laser, it has to be the whole lot together.
Okay. There are many questions coming in and quite a few from Facebook, and we also have a lot of viewers on Facebook. Dr. Zubaida asked, what's your opinion on coenzyme Q10 versus retinol?
Coenzyme Q10 versus retinol. Um, can I know what form of coenzyme Q10
Yeah,
is?
I think I
Yeah.
think she would be thinking about oral. So
Uh, my take is retinol. Retinol has got a very long-standing history of how it works, and studied many studies on it, and it works very well for photoaging and anti-aging. Yeah,
okay.
that's
Now,
definitely.
Junik asked if pores and whitehead can, what kind of skincare or skin pill can resolve this problem? So we do have, I think, a lot of public viewing, so their questions may be a little bit different. So she asked that
Sorry.
whiteheads.
Okay, whiteheads. So when we talk about whiteheads, I think you're talking about comedons. So when you're choosing your skincare, number one, you have to go. It's a precursor for acne, so you have to go for this acne range kind of treatment. Skincare, and always choose a skincare that contains non-comedogenic. The word non-comedogenic, so you don't block your pores. Yeah. And in terms of the pore size, if you want a treatment that's going to reduce your pore size by using skincare alone, um, retinol is good. Okay. So a retinol based skincare is good. That has got a strong proven evidence that can reduce the skin, but not after using for 1 2 months. Is you should at least, sorry, you have to use at least for 2 months to see the effect, but not significant. Just very subtle changes. You want significant, then you need to go for laser treatments. Yeah.
Okay, so let's take more questions from Zoom. Uh, okay, this bifunctional laser treatment, have you answered this one? May
Bifunction.
you comment a bit on bifunctional laser treatment meant for removal of hair at the same time for rejuvenation therapy?
Yeah, so you see, there is like, as times have evolved now, a lot of laser machines, and because of the land that it targets and everything, because you're just going down to your basic, where your hair follicle is, um, and where your dermis is. So the same wavelength can target both, so it can work. Yeah.
It can work, huh?
Yeah.
Okay. Um, Dr. Kyra asks, is triluma effective for hyperpigmentation?
It is a very effective treatment for hyperpigmentation, but always know the when you're using it, it has got a lot of patients don't tolerate it. So the way you start it is important, like how I mentioned it, twice a week or and then 3 times a week, slowly increase the frequency. Number two, always know when to stop it. So don't overuse the treatment. I My take is don't go more than 60 days, then so you can use it to bring down. The moment it's better, you switch to something more that is safe, then can use long term, like your tranexamic or kojic acid and arbutin and all that.
So this tranexamic acid can be used long term, right?
Can.
And is the twice a day um, regime enough?
Yes, it is.
Because I find tranexamic acid quite useful for me.
Yeah.
Because I am one person who am out in the sun a lot. And I
You
do,
do. Uh-huh. Yeah.
yeah, because I do diving, I do climbing. And
You
I
sh-
didn't start using sunblock until much later in life, like mid or late 40s.
well, if you do so much of sun related activity, Heliocare oral sunblock is actually good. I would advise you to take it on
Which
top of your topical.
Oh yes, yes, I do take. You mean the oral sunblock?
Yes,
Yes,
yes.
yes. I started last year.
Very good.
I also
Yeah.
find it quite. Yes, yes. I find it quite useful. Um, and it's yes, I like it also.
Yeah.
But I am not one that really, really, to be honest, like how you call it? Um, take care of my skin very well. But I'm
Okay.
trying to, and after this, I think I will do better. I have a lot of pigment. Last time it used to be freckles, and then it just became like a world map now. So, okay, let me see if there are any more questions, and then we will close the session because I'm
Yeah.
able to share okay, I'm able to share sorry, so, how you call that? Distracted by sharing of this thing. Okay, so I can't find the old
Someone
question.
asked about hypopigmentation caused by hydroquinone. I think you're talking about hyperpigmentation that's caused by hydroquinone, the onchronosis. It is very difficult to treat. It's pretty much permanent. So that's why always limit the usage to 2 months. Okay. And the moment, most of the time, I will use it. The moment it's lighter, I'll always change my regime. I will not put someone on hydroquinone like for a long term, because when you get that onchronosis, it's almost difficult and very you those even a patient that I'm treating multiple sessions of chemical peel with ENIAC laser, you still see don't much of improvement. That's very minimal improvement, but that's as much you can, but you have to keep trying. Yeah. So
Okay,
someone asked
yeah, that's right. There's a question about
keloid.
needle and needle shoot. What riddle shoot needling?
I'm
Dr.
sorry.
Nurihan asked, what is riddle shoot micro?
I guess I would just take it as she's asking about that micro needling radio frequency. Is it good for anti-aging, as I presented? Because it contains this multiple shots of needle that penetrates your skin. It is good for anti-aging effect and skin rejuvenation, and it really improves your fine wrinkles. Yeah.
Okay, and then we take one last question, and I think it's on the keloid. I think this one is not related, but we'll take this question. Um, is there any treatment for it?
Um, Infant, the word infant really baffles me, because
Yeah.
generally, Pediatric age they do not get. If you're really talking about infant, I will just say leave it first unless the child is scratching it. I mean, I'm yet to see, but just leave it. And if you're talking about your BCG or what, I'm not sure, but uh, if it's symptomatic, and just see your dermatologist and get a prescription, probably a short duration of a topical steroid to help with that symptoms. Otherwise, in terms of keloid treatment, yes, there is a lot of keloid treatments available. Most common one is intralesional steroid injection. So let that be for your infant and let the child grow up. And when they are ready, you can always, because it's at the end of the day, it's cosmetic. Unless some have got symptoms like pain, and because it's rapidly enlarging, itchy, then you may intervene. But otherwise, you can always wait for the right time to intervene.
Okay, so when are you back from Texas?
August. Oh, Texas. I'll be back in end of the month. I'll come back on the 2nd of May. But then after that, I'm going to be in Bangkok for another 3 months.
I see. You haven't finished your Bangkok stint yet.
Not yet. So August onwards, I'm only in Malaysia. Yeah.
Oh, so you'll be in Bangkok more than a year.
Yep. 13 months.
Oh my God. Okay. So we hope that you have a safe journey back and stay
Thank
safe
you.
in US. And also then when you come back, then maybe we'll have another session with you.
Yeah, I think those injectable is another big topic to cover. So
Right.
I just mentioned the gist of it.
Yes.
That'll be interesting.
Yes. I'm thinking of doing um maybe more of a podcast kind of thing. We'll look into it. Yeah.
Can.
So we will stop recording now and